At the time I was diagnosed, I think your first thought is, you may not survive this.
I was completely devastated. I had about a 20% chance of being alive in 5 years.
Every day I am looking into the eyes of people who are dying of this disease. And that's what drives us. That's what drives our team to fight this disease on all fronts.
Chemofog is actually a term that was coined by patients in reference to a certain foggy-headedness, foggy-mindedness, mental inefficiency that they experienced while they were undergoing chemotherapy.
Sometimes I'd start a book in the evening and finish it at dawn, but then with chemo, I could not read a book.
This research in trying to demonstrate more definitively whether there is or is not a disturbance in cognitive functioning associated with chemotherapy goes a long way to validating patients' experience and complaints.
Multidisciplinary care for breast cancer patients really is a breakthrough now for London in that it affords them direct and rapid access to the subspecialists as they need it. The main thought is if patients do then progress in their disease, we need to be rapid in our interaction with the various subspecialists so that we can intervene when necessary.
I didn't realize I was having multidisciplinary treatment. All I know is that once I started in the system, everything flowed very smoothly. The first chemo I had didn't work, and that was very distressing. When I let Dr. Brackstone know, she convened a meeting with the medical oncologist, and the three of us discussed the options. I opted to change chemos, and that was the right decision.
Well, when x-rays are done of the breasts of apparently healthy women, the appearance varies. Some people have a lot of white tissue in the breast and others have virtually none. And the white tissue is what we refer to as density. And what we and other people have found over the last several years now is that the amount of this white tissue is very strongly related to the risk of breast cancer developing. So our long-term vision is that breast density provides us with a tool that might be used to prevent breast cancer. So we might be able to identify it at early ages, we might be able to modify it and reduce the risk of breast cancer in the future.
My mother met one of the solicitors of the project and asked me if I wanted to do it. It's very important because something I would want to know about ahead of time, well, because then there's more of a chance of preventing it.
I'm very proud of Maddie, and I can't think of a better form of community service than in participating in research like this.
We found this association with breast cancer risk and women who had worked in farming. We interviewed almost every woman for 2 years that was diagnosed with breast cancer at the Windsor Regional Cancer Center. We found not only this association with farming, but if they went on to work in healthcare or in auto-related manufacturing, their risk either essentially remained the same or it increased.
It opened my eyes to the fact that my environment had not been the safe environment that I had thought it was. I grew up on a farm. I remember the smell of DDT and pesticides as a child. I went directly from there to London, where I went into nurses training school. It certainly never crossed my mind in all the years I've worked in nursing that it was really a hazardous place to be.
Research isn't just about talking about things, it's doing things and it's changing patients' lives. The mandate of my team's work here is to develop practical strategies that help women with breast cancer today. We can use drugs to fight breast cancer that spreads to the bone, the most common place that breast cancer spreads to. We can use our drugs in a more effective way that makes our patients' lives better and helps destroy their cancers. And the Canadian Breast Cancer Foundation funded this innovative research. This was the first time this study had been done anywhere in the world, and the findings of this study are making a difference for patients today.
Although the 5-year survival rates for breast cancer are reasonably good, many women still succumb to this terrible disease. For certain forms of breast cancer, the survival rates still remain quite poor, With optimal treatments, I believe that these survival rates are going to improve.
I don't think we could have done this breast cancer research without the Canadian Breast Cancer Foundation. It's very difficult to get funding for research that tends to be controversial.
Without the help and support of the Canadian Breast Cancer Foundation, this research project really would not have been possible.
Virtually at every stage of our work, we've been proposing new things, and necessarily new things are controversial. Being able to address those problems, and we think unequivocally answer them, through this funding mechanism has been absolutely fundamental to what we do.
Without the fellowship and the support from the Canadian Breast Cancer Foundation, it would have been impossible for me to obtain a position here as a surgical oncologist or as a breast surgical specialist.
Thank you on behalf of my clinical team. Most importantly, thank you on behalf of my patients. Your donations are making real change happen.